Aortic dissection is caused by a weak aorta, the artery that carries blood from the heart to the body. When it ruptures, it's often deadly.
50% of the time, people who present with dissection don't make it to the hospital. Of the people who do make it to the hospital, only half of those survive.
Meaning time is critical.
The way that how we've gotten better results is understanding how to protect the brain during the surgery. It's what we call antegrade cerebral protection.
Doctors do this by using hypothermia induction, or cooling the body to preserve the brain during heart-lung bypass.
What we call hypothermic circulatory arrest is when we cool the body down, we stop all flow, blood flow to the rest of the body.
Sandra Fernandez loves to spend time in her kitchen, but recently surgeons needed to treat an aortic aneurysm. Dr. Lee removed Sandra's aneurysm and replaced her heart valve during the operation. Doctors induced hypothermia to protect her brain function.
Whatever we've been able to fix will stay that way for her for the rest of her life.
Sandra woke up in recovery to a very happy family. Now she's enjoying life, cooking for her kids, using her grandmother's precious recipes.
I feel happy because I say, okay, I'm here again, I survived.
I'm Marty Salt reporting.